Ismail Arbabi, consultant eye surgeon and the lead for laser and vision correction services at the Royal Liverpool University Hospital. In this video, which is one part of my long video on A to Z guide of laser eye surgery, I will aim to give you a good understanding about the safety and risks of laser eye surgery and give you some statistical results based on large studies on the topic. So, is laser eye surgery safe? With 30 years track record of groundbreaking improvement in laser eye surgery technology and over 40 million procedures performed worldwide, laser eye surgery in fact is one of the most popular and most successful elective surgeries in the world, with a remarkably high satisfaction rate amongst patients who have had the procedure. According to the Royal College of Ophthalmologists, 95% of patients are satisfied with the outcome of laser surgery, and many actually describe it as life-changing. However, like any other surgery, there are some risks. Fortunately, in most people, even if a complication were to occur, it tends to be mild and short-term and usually treatable. However, a small percentage of patients, they can experience a long-term and serious complication that may cause eye discomfort or visual problem. The chance of a serious complication is about 1% in general and probably less than 0.3% in an expert and experienced surgeon. Some people are at higher risk of complication than others. For example, if you have very high glasses prescription or you have certain eye or medical condition, your risk is likely to be higher. Therefore, a thorough pre-treatment assessment is vital to ensure you are suitable for surgery, and if you are at higher risk, this is discussed with you. Glasses are the only vision correction option which are totally risk-free. All other vision correction options, including contact lenses, have their own risk. So what are the statistical results and research results for laser eye surgery? There have been many published studies in the literature that evaluated the result of laser eye surgery. One of the largest review paper actually aggregated data from 97 other major studies and 67,000 eyes that had LASIK surgery. Showed that LASIK had very high success rate, with 99.5% of patients having better vision than driving standard without glasses, and 99% of patients were satisfied according to this study with the laser eye surgery. The glasses prescription after laser surgery was 1 diopter or less in 99% of patients. This study also found in only 0.6% of patients the vision was worse by 2 or more lines on the visual chart compared to the vision before surgery. This study was published in 2016 and acknowledged that the aggregate results were much better in the past decade compared to the studies published using all the laser technologies. It therefore concluded, I actually quote from the study, modern results support the safety, efficacy, and patient satisfaction of the procedure. Another 2 big studies called PROWL-1 and PROWL-2, which stands for Patients Reported Outcome with LASIK, assess visual symptoms before and after LASIK surgery in identifying changes over time. These 2 studies were the result of a collaboration between military and non-military ophthalmologists in the USA in conjunction with the FDA or Food and Drug Administration. These 2 studies found over 96% of patients had 20/20 or better vision without glasses. More than 95% of patients were satisfied with the vision following LASIK surgery. It also found 28% of patients developed mild dry eyes after LASIK, but in 65% of patients who had dry eye symptom before surgery had no dry eye symptom after LASIK. It also showed that less than 1% of patients had symptoms that gave them a lot of difficulties or prevented them from doing their usual activities. Now I will take you through detailed analysis of the risks associated with laser eye surgery and also explain how common they are on average. Dry eye symptom is by far the most common side effects. About 30 to 40% of patients can actually experience some degree of dry eye symptoms post-surgery. The reassuring part is these symptoms tend to be mild and resolve in overwhelming majority of cases. If you are going to get dry eyes, it tends to be worse in the first 3 months and then resolve over the next 6 to 12 months. Although persistent and severe dry eye symptoms are rare, especially if you didn't have any pre-existing dry eye symptom before laser eye surgery, they may still occur in about 2% of people. So there is a very small risk that you may have to live with dry eye symptoms or require long-term or permanent treatment for dry eyes. In a very small subgroup of patients, dry eye symptoms actually can be very distressing and debilitating and may affect all day-to-day activities. The second most common symptom is experiencing some degree of visual disturbances such as glare, halos, starbursts, and decreased quality of vision overall. This can particularly be troublesome in low light level and may affect particularly nighttime driving. This complication used to be more common with the early generation of laser technologies. However, with the modern flying spot laser technology and new algorithms, this is far less common now. These symptoms occur in about 20% but tend to resolve spontaneously in most people. Rarely, they may need additional treatment or repeat laser surgery to resolve. In a very small number of cases, these symptoms actually may not resolve or be treatable and may cause permanent symptoms. In Prowler's study, less than 1% of patients had visual symptoms that significantly affected their day-to-day activities. The third most common side effect is under or overcorrection of your glasses prescription, so that your glasses prescription may not quite be close to zero. Less than 5% of patients may require enhancement, which means repeat laser treatment to smoothen out any remaining nearsightedness, farsightedness, or to correct any irregularity of the corneal surfaces. The repeat laser is usually suitable and highly effective in majority of patients to correct any residual glasses prescription. However, a very small number of patients may not be suitable for enhancement and hence may still need glasses or contact lenses after surgery, or they may need to have other type of surgery. Therefore, it is important to understand that it is not always guaranteed that you will be glasses free. Another important point to realize is that it is normal to require reading glasses from around the age of 45 years with good uncorrected distance vision. This is a normal aging process which is called presbyopia. This process explains why people who have never required glasses in their past start to wear glasses for reading and near work once they get in their 4th decade of life and beyond. This process is not altered by laser eye surgery. So if you have laser eye surgery before this age, you are very likely to require glasses for reading once you get in your 4th decade of life and beyond. However, there are effective treatments available to reduce the spectacle dependency for all the patients, such as presbyon laser blended vision or refractive lens exchange or monovision. Now, it's important to understand laser eye surgery results are intended to be lifelong, but in a small percentage of patients, they may encounter what we call regression, where you may become nearsighted or become long-sighted again. This regression is more common in people who are long-sighted and on those people who have very initial higher glasses prescription. This may happen months or years down the line after the surgery. One of the most serious complications is corneal ectasia. In this condition, the inner corneal layer becomes weak, causing cornea thinning and irregularity of the eye surface, which leads to eventually poor vision. This condition is similar or maybe identical to another condition called keratoconus, which occurs in 1 in 2,000 of general population who never had laser eye surgery. The risk of corneal ectasia after laser surgery with modern lasers is generally lower than in general population due to the diagnostic pre-treatment test, which highlights those patients who are at high risk. This condition used to be more common with early LASIK technology, when a microkeratom used to cut the corneal flap, than it is with the advanced femtosecond laser, which is a bladeless surgery. A study by NICE estimated the risk of ectasia was 0.2%, but highlighted that most of the affected eyes may have been selected inappropriately for LASIK treatment, which means a lot of them should not have had laser eye surgery as they were at high risk, and this should have been picked up by the treating surgeon before surgery. This used to be the most dreaded complication, which usually require a corneal transplant. However, over the past decade, luckily there is a treatment called corneal collagen cross-linking, which is very effective if the condition is diagnosed and treated early. Another serious complication is corneal infection. This is estimated to occur in about 1 in 4,000 cases. Again, if this is diagnosed and treated early, it can lead to good visual outcome, but it has potential to cause significant corneal scarring and may require corneal transplant. If you are a contact lens wearer, then your risk of getting a serious corneal infection is actually 1 in 3,000. With a laser eye surgery, the risk of infection, if it occurs, tend to happen in the first a few days to weeks or maybe months post-surgery. However, with contact lens, the risk of infection is always there for as long as you're wearing contact lens. There is 0.6% chance that vision may be worse than it was before surgery. Another complication which specifically happen only in LASIK as opposed to PRK and the smile is those that related to the flap, because this has a flap, and these flap related complications do not happen in LASIK or in smile, which is a flapless surgery. However, the risk with flap has significantly reduced with modern bladeless femtosecond laser compared to the first generation LASIK, which used a microkeratom. These complications, if occur, include misalignment of the flap, epithelial ingrowth, and inflammation and abnormal healing of the flap. These complications may require another procedure and or intensive treatment with eye drops. Most of these flap complications often can be treated successfully. However, very rarely, flap-related complications can lead to permanent decrease in vision. Another rare but extremely serious condition is called corneal neuralgia, where the corneal nerves or the nerves within the eye become hypersensitive. It can cause burning, stinging, and light sensitivity. However, in some patients, it can cause excruciating and debilitating pain, which may be difficult or even impossible to treat and may require strong painkiller tablets as well as many eye drops. Corneal infection or inflammation may lead to corneal haze or corneal scarring, which can be minimal and not troublesome or could cause a significant visual loss. About 1 in 5,000 or 0.02% of patients may need corneal transplant as a result of these complications, or if they develop other complications such as corneal ectasia. Corneal transplant is a major surgery, but if required, a good level of vision can often be restored in most people, although glasses or contact lenses are likely to be required after the surgery, and the visual rehabilitation and gaining vision may take quite a long time and may take many months. What I have explained so far are the main complications which could directly be caused by laser eye surgery. However, in theory, there's always small risk that you may get indirect complication of laser eye surgery. I would not go into those complications, but they may possibly include things like retinal detachment, glaucoma, bleeding, and so on. And thank you for watching this video, which I sincerely hope has been helpful.